Welcome back. Tuesday here on BT Vancouver. Beautiful shot there at downtown Vancouver. It's approaching 7:45, and we're talking COVID-19 numbers right now. We've had 102 new cases in BC since Friday, and we're seeing a little bit of an uptick, according to Dr. Bonnie Henry, and she particularly pointed out the province's young adult population, making a plea essentially to them to stay vigilant and watch out when you're gathering in large crowds, especially at the beaches. We're going to bring in family physician right now, Dr. Yvette Lu, to shed some light on this. Good morning to you.
Good morning.
First of all, let's talk about honing in on the young people. Why did Dr. Bonnie Henry single out that particular group of population when it comes to fighting COVID-19?
Well, what we found is that the cases in the last few days have been mostly people in their 20s and 30s because they've been gathering in large groups. So young people are less vulnerable to the disease, so they may feel like that if they get COVID-19, it doesn't matter. However, young people can get serious illness and life-threatening complications from COVID-19, so it is important for them to be careful not to catch the disease. Also, it's important for young people to remember that even if they don't have a serious infection, they can spread the virus to someone in their family or in their friend group who can have a serious infection, and nobody wants to be responsible for spreading the virus accidentally to their family and friends. The recent survey yesterday also shows that young people have been more affected by the virus. They have reported increased financial difficulties, increased job loss, and increased mental health difficulties. And perhaps that's why they may be gathering in larger groups. Perhaps they're doing that for their mental health. But it's important still for us to be gathering safe.
Okay, we'll get into that in a little bit after, but first of all, let's talk about how we can manage this increase in numbers here in BC when it comes to COVID-19.
Yes, it's important for us all to remember that we're still vulnerable to the virus. Only less than 1% of people, according to the antibody, have been infected. So that means over 99% of us are still vulnerable. So even though we're in phase 3, we still need to remember all the things that we were doing in phase 1 and phase 2, like washing our hands, wearing masks, and most importantly, physical distancing and staying in small groups and staying home when we're sick.
Yeah, that's the big one, because a lot of people still feel like there's some apprehension about calling in sick, but the province is urging people, if you do feel sick, you know, there will be arrangements made with your workplace. It's okay, you know, you don't have to try to be a hero and come in, because it's for not only your safety, but the people around you in your community.
Exactly. It's very important.
Yeah. Okay. Let's also talk about masks and the importance of that when it comes to kids going back to school in September. A new Leger poll said that 41% of people would want their kids to wear masks on the bus or in school. What kind of analysis do you have on that?
We do recommend that people wear masks when they're not able to distance properly. So the first and most important thing is to have physical distance, because that's what works best. When we can't distance properly, we recommend wearing masks. However, there is a challenge in schools, especially with young children, with them touching their face a lot, fidgeting with their mask, having itchy faces. And if they're touching their face a lot and they can't take the mask, then for them to wear a mask, and it could even lead to increased infection if they don't know how to use their mask properly.
And just quickly as we wrap, what are some other ways that we can gather safely? I'm assuming smaller numbers.
Yes, exactly. So the increase in numbers having safe interactions, because it sort of increased the number of people we're interacting with. But we all need to remember that we have to gather in smaller numbers. So we still need to have our pandemic bubble. It can be bigger than it was in phase 2, but it still is a group of people. So you always want to gather with the same group of people in that pandemic bubble. You don't want to gather with one group of people one night and another group of people another night. And then when we gather, we want to keep to smaller groups. Only 6 people, for example, at a restaurant table, and no table hop, and you don't want to be bouncing back and forth, because that puts the servers and the restaurant staff at risk. And then finally, if you're gathering in a group, you want to make sure you know everyone in the group and how to contact them. You want to have their contact information, phone number, email, have a designated person to take down everyone's contact information, because that way, if there is an exposure event, public health can contact everyone before they spread the virus to a lot of other people.
Okay, great advice as always. Thanks so much, Dr. Lu.
Thank you. Take care.
All right, you take care. Have a great day. That's family physician Dr. Yvette Lu, and we'll be back with